Pleural effusion. Pleural effusion is an excessive accumulation of fluid within the pleural cavity or between the lining of the lungs and chest cavity. Pleural effusion is also known as pulmonary effusion. Pleural effusion may be caused by irritation, inflammation, or infection of the pleura. The pleura is a thin piece of tissue with two layers. One layer rests directly on the lungs, the other rests on the chest wall. In a healthy individual, a small amount of fluid is present in the pleural spaces, which reduces friction between the pleural layers and allows for a smooth lung expansion and contraction with respiration. A pleural effusion occurs when there is more fluid than normal. The excess of fluid may prevent the lungs from fully expanding. As a result, patients may have a hard time breathing. It's a serious condition associated with an increased risk of death. Causes. Some of the major causes of pleural effusion are congestive heart failure, malignancy, pulmonary embolism, lung infections such as bacterial pneumonia or tuberculosis, and lung cancer. Other causes include liver cancer, pancreatitis, nephrotic syndrome, cirrhosis of liver, autoimmune diseases such as lupus and rheumatoid arthritis. Pleural effusions can be the result of cancer cells spreading to the pleura. Fluid may also build up as a result of certain cancer treatments such as radiation therapy or chemotherapy. Mesothelioma of pleura. Mesothelioma is a malignant tumor that's caused by inhaled asbestos fibers and forms in the lining of the lungs. The most common cause of pleural effusion in children is pneumonia. Sometimes the effusion becomes converted into pus and called as a empyema. Symptoms. Some pleural effusions may be asymptomatic. These people usually find out they have the condition through chest x-rays or physical examinations done for another reason. Symptoms may vary and can depend on the severity and cause of the effusion. 500 ml of fluid should be present to produce the signs. Common symptoms include chest pain, shortness of breath, difficulty taking deep breaths. Pain increases with deep breathing, bulging of intercostal spaces on the affected side, shift of mediastinum to the opposite side, difficulty with physical activity, headaches, night sweats, cough. If the pleural effusion is caused by infection, then patient will experience symptoms such as fever, chills, and loss of appetite. Types. There are several types of pleural effusions, each with different causes and treatment options. The first classification of pleural effusions is either transudative or exudative and complicated or uncomplicated. Transudative pleural effusions. This type is caused by fluid leaking into the pleural space as a result of either a low blood protein count or increased pressure in the blood vessels. Its most common cause is congestive heart failure. Exudative effusions. This type is caused by inflammatory conditions like pneumonia, pulmonary embolism, and lung cancer. The extra fluid surrounding the lungs needs to be drained in this situation. Exudative pleural effusions are often serious and difficult to treat. Complicated pleural effusions indicate grave signs of infection and inflammation, which, if left untreated, could scar lung tissues to a great extent. They require prompt treatment that frequently includes chest drainage. Uncomplicated pleural effusions contain fluid without signs of infection or inflammation, hence, the risk of developing serious pulmonary diseases is very low. Diagnosis. A healthcare provider initially conducts a complete physical exam to find out if there are any external signs that indicate problems with the lungs and breathing. Physical exam findings consists of dullness to percussion in the lung region, and there is asymmetrical chest expansion with unequal inflation or deflation of the lungs. On auscultation, there will be decreased breath sounds on the affected region. Other diagnostic tests include blood tests, imaging tests, X-rays, chest ultrasounds and CT scans, pleural fluid analysis, bronchoscopy, and pleural biopsy. Treatment. The underlying cause of the condition and the severity of the effusion will determine treatment. Minor cases of pleural effusions only require the underlying disorder to be rectified, without any invasive procedures. Examples include antibiotics if pneumonia is the root cause, or diuretics if effusion occurred due to congestive heart failure. Most people recover within a few days or weeks. Thoracosynthesis. Draining of the pleural fluid is the first line of treatment, which is done by thoracosynthesis or a chest tube. In thoracosynthesis, a tube is inserted into the pleural cavity and the fluid is drained out. You may feel some pain or discomfort at the incision site. Most doctors will prescribe medication to help relieve pain. For continued drainage, the tube needs to remain in the pleural space for days or weeks. You may need this treatment more than once if fluid builds up again. Also depends on the amount of effusion fluid and the type of effusion. Medications for pleural effusions are prescribed depending on its underlying cause. Antibiotics help treat an infection caused by bacteria. Diuretics and cardiac medicines may be needed if the pleural effusion is caused by congestive heart failure. Steroids or other anti-inflammatory medications may reduce pain and inflammation. Chemotherapy, radiation, or a medication infusion within the chest may be needed if the pleural effusion is caused by cancer. Surgery may be needed in some cases, often in exudative type, to break up the adhesions. Some effusions may need pleurodisease, a procedure performed to drain fluid or air entrapped inside the pleural space. Different medications are used during the procedure inside the pleural space, which will seal the pleural and visceral surfaces together, which prevents the future buildup of fluid or air between them. Pleurectomy, in which part of the pleural lining is surgically removed, may also be an option in certain cases. Complications. Complications of pleural effusion can result from the disease itself or from complication of treatment procedure. Minor complications include pain and discomfort, which often go away with time. Serious complications can include pulmonary edema or fluid in the lungs, pneumothorax as a complication of thoracosynthesis, scarring of the lung, blood infection or sepsis, and empyema or a collection of pus within the pleural space. Preventing pleural effusion. Maintain a healthy lifestyle. Eat a healthy, balanced diet with plenty of vegetables, fruit, and lean protein. Healthy, balanced foods include fruit, vegetables, whole grain breads, low fat dairy products, beans, lean meat, and fish. Limit sugar, fat, and alcohol, and maintain a healthy weight. Healthy eating is important during and after treatment. Exercise regularly. Resume normal exercise after treatment. Exercise will lower your blood pressure and decrease stress. This helps decrease your risk for another pleural effusion or a lung infection. Quit smoking and do not allow others to smoke around you. Smoking and high blood pressure put you at greater risk of getting pleural effusion. Ask your healthcare provider for information if you currently smoke and need help to quit. Avoid intense workout. Avoid physical activity that may intensify pain or breathing problems. Seek medical attention if you experience chest pain, difficulty breathing, or fever, or if your symptoms worsen. Get plenty of rest. Find healthy ways to manage stress and aim for 7 to 8 hours of sleep at night. Get in the habit of washing your hands frequently to avoid exposure to viruses or bacteria. Stay hydrated. Drink lots of fluids. Ask your healthcare provider how much liquid to drink each day and which liquids are best for you. Outlook. Pleural effusion is a sign of an underlying condition. Pleural effusions can be serious and life threatening. The outlook and time needed for recovery will depend on the cause of the effusion, the person's overall health, and how severe their symptoms are. Most require hospitalized treatment and some require surgery. Malignant pleural effusion is associated with a very poor prognosis. Example includes lung cancer in men and breast cancer in women. If you found this video helpful, please do like and subscribe to my channel, and don't forget to click on the bell icon to get new video updates. Thanks for watching.